This podcast may not contain all of the information on the covered topic that is important or relevant to you. You should not place undue reliance on the accuracy, fairness, or completeness of the information presented. This content should not be used as a substitute for independent clinical judgment. Anyone with questions or concerns about the covered topic should consult with their healthcare provider. This HCA Healthcare podcast is intended to inform providers on our hospital's medical staffs, our employees, and other interested parties.
Hello and welcome to Selfcare for Caregivers, a wellness podcast series brought to you by HCA Healthcare. I'm Dr. Frank Drummond, National Medical Director for Behavioral Health Services. And today I have the pleasure of being joined by Jeffrey Cluver, Trident Health and Colleton Medical Center Medical Director for Behavioral Health Services there in Charleston. Welcome, Dr. Cluver.
Thank you, Frank. I appreciate having the opportunity to be here.
Today our topic is broadly pandemic parenting. It's something that the entire world has had to deal with. There's issues around being a child of a psychiatrist that we could talk about, being a child of a doctor, bringing home the virus to your family when you're working in healthcare settings. There's just a ton of parenting topics that we're going to try to sort of get into a little bit and include our own personal experiences and hopefully come up with some of our learnings going forward. I'll start with something that I noticed a long time ago. The annual meeting for the American Psychiatric Association always has a meeting called Children of Psychiatrists. It's like a 4-hour meeting. It's always sold out. I've never been able to get in. I've never been able to find out what they're actually talking about. But it always made me take pause and say, is there something I'm missing that I should be thinking about as a psychiatrist parent? So I've yet to work that out. I don't know if you have any ideas about that.
Well, I think it depends on who you ask. If you ask my children, they would say that being the child of a psychiatrist has its moments, both good and bad. I think all in all, they appreciate it, but they will often use that as an excuse not to answer a question I've asked them and accuse me of trying to psychoanalyze them. So
right.
They will certainly use that against me.
Can you tell us a little bit about your family?
Sure. Yeah, so we have what we consider a blended family. My wife is an attorney and an author, and she has 3. I'm going to refer to them as children once, and then when I tell you their ages, realize we're not talking about small children. So she has a son aged 13, 2 daughters aged 15 and 17. I have 2 sons aged 13 and 15. So we have a blended family that includes 5 teenagers, and this has been a very interesting year for all of us, to be sure.
What's the family dynamic been like, or what have you observed over the year?
Yes, I think I've often talked about everything we're dealing with COVID using the language of grief to some degree. We're all grieving our usual routines and the things that we all have not been able to do for so long. And it did start for us with a little bit of denial. Is this really happening? Are we really not going to be going to school? And really that initial shock took a long time to get over. And once it did, then we got into a waiting game of, well, how long is this going to last? And now we're just in that sort of fatigued area, hoping this is not the new normal. Our children started out again, in denial, but then once they understood the magnitude of what was going on, they were very, I think, resilient and flexible. Certainly in the latter months and here recently, you really starting to see the wear of just wondering how much longer this is going to go on. Our 17-year-old is enrolled to start college in the fall, and every day the first question she has is, what's that going to look like? And am I going to be able to go and have a normal college experience?
You and I worked together a lot early pandemic, and I'd like to know what your experience has been talking to your children, maybe particularly the younger children, knowing what you did know about it as we knew more and more about it, how to talk to kids about the pandemic and in particular about the future. Like what has been your strategy, or what do you find has been successful?
Right. And so kids know when you're lying to them. And so, being honest, including being honest about what we did and didn't know, especially early on, I think was very important. And being honest about your own feelings, I think, is important as well. Telling them when there's times that as adults you're confused or even a little bit scared, you certainly don't want to run into the room screaming, yelling the end is near. But talking about the anxiety and fear that you're experiencing, I think is an important message to your kids, to let them know it's okay to be feeling this way. It's okay to share that you're feeling that way. And in fact, it's incredibly helpful to share when you're feeling that way. So being honest about both what we knew and didn't know and about our feelings has been really one of the most consistent things we've tried to do. I'm not sure we've done it perfectly all along, but that's really kind of how we tried to center all of our conversations with the kids.
Got it. You mentioned this earlier, and I think to a lot of families, they're getting into the kind of rhetoric or words of like, well, when this virus is over, Daddy, I'm going to do this. And when the virus is over, I'm going to do that. And what is it going to be like when the virus is over kind of thing. Personally, I've tried to get my children ready for maybe some permanent changes in the way that we manage some social functions, maybe wearing a mask. Some of the other things are going to probably change permanently in the way we behave. What have been some things that you found that as you talk about the future with your family?
Yes, I think I've been hopeful all along. I mean, I have said from day one that I'll start by telling them maybe I'm being naive, but things will get better. I mean, that's a message I give to the patients I work with every day. And I think that translated well to being in a state of sort of not only the unknown in the moment, but the unknown of the future. And I feel pretty confident saying it's not going to be like this forever. And certainly it's going to be a whole lot better. It's not things, I agree with you, there'll be some things that maybe are more long-term or even permanent, but things will be returning more to normal at some point. We just don't know when. I also have always really congratulated them on how well they're handling it. And on days when they don't handle it well, tell them that that's okay. And so, the other thing we've tried to do throughout is try to create some space for some new routines and some new kind of habits that help us get through this. And that's been important. That's hard to do, especially as, at least down here, our kids have gone back to school. They are getting busier, but we're trying to create some fun and some new routines to, help them get by day to day.
Right. I would put that in the category of mindful parenting. I think a lot of families, as they were getting through this, they realized they were spending lots of time with their family. How much of that was actually mindful, thoughtful time, like you said, creating new experiences, really capitalizing on the fact that you are together? Like, what are the advantage of it, the silver lining aspect of it? And what's mindful about giving them their space and their freedom, et cetera? What are some examples of some like mindful parenting that you've been doing?
Yes, and I think especially with teenagers, there's that challenge of spending time with them without encroaching upon their time and space, even when there is lots of time.
Right.
So I think that one of the things I've done is to just downtime and doing nothing is fine. And sometimes just appreciating that you are in the same space, trying to do some of the more cliche parenting things like having meals together with teenagers, especially one and soon to be two that are driving. Meals can kind of be picked up on the way home and people kind of eat in their separate corners, and just making an attempt to have some time that's set aside, whether it's sharing a meal. I'll go in and sit down on my kid's bed and ask if they need any help with some homework. What are they working on? What are they doing? And I can take a hint quickly. I'll get out of there if they're not feeling it in that moment. Mm-hmm. But we talk in the hospital about making leadership rounds. And I feel like sometimes that's what I'm doing in my home. I'm doing parenting rounds, mm-hmm. Just kind of checking in. How are you doing? What do you need? Is there anything else we can do to make your day a little more interesting? And I think that's, as I reflect back on what I've been doing and maybe what's a little different than before, that's one of the biggest things.
My kids are 6 and 9, so it's a little bit of a different dynamic for us. But I found for a period of time I was raising them like they were twins or something, like just doing everything as a lump together. And when I try to be more mindful about what would be appealing to one of them and how to get them separated in a way that doesn't cause any controversy. That really went a long way for their connection with me, I would think, and also the way I understand them. So there's nothing like having a kid in the back seat talking while you're driving just to McDonald's to get a sundae at the drive-thru or whatever excuse you make up.
No, that's great. And it's interesting you say that, because at the age that all the teenagers are in my house, they separate themselves out fairly naturally. And really, they will claim that they don't want to be around the other person that's in the room, from time to time, as teenagers will. But I think you do see that dynamic where they're almost seeking out that one-on-one time as well. And when you see that happening, harnessing that for sure. So it's interesting, because I'm not sure that I was as aware of that happening, but as you just described your scenario, I can definitely see that playing out. In my home, it seems to be more driven by the teenagers than purposefully by us.
Interesting. I'd like to talk a little bit about one of the other big dynamics of being a physician during the pandemic with kids. There was a period of time where a lot of physicians were treated as bad people in the communities because they were going to work and coming home and being around their kids. This is early, maybe for 6 months. And then the play dates, the limited, even small circle play dates kind of dried up and people were avoiding them actively. Have you worked with any colleagues or had any experiences like that you've noticed, and has it changed?
Yes, I think it's changed, but I'll go back to those early days when everyone was home. There are a couple dynamics, one that continues on, but the early dynamic of almost not wanting people to know that I worked in a hospital. So I would tell the kids, and as restrictions started lifting and there were some interactions mainly around sports early on, I did find myself telling the kids, if anyone asks what daddy was, tell them I'm a psychiatrist, and just kind of leave it at that. Knowing that I was a psychiatrist that worked in a, hospital where many patients with COVID were being treated, we did not want to go into that detail. Again, I think that dynamic has changed, especially as vaccines have rolled out and healthcare workers are being vaccinated. Another interesting dynamic of working in a hospital during this portion of time is that I've gone to work every day. There's not been a day other than scheduled days off that I haven't driven to the hospital to go to work. So my wife is an attorney. The law office that she worked in closed, and she's actually been working from home ever since. So she was home, the kids were all doing school from home, and I went off to work every day. I certainly had some anxiety about whether or not I was bringing COVID back home every day, and you develop rituals around trying to do everything you can to protect yourself at work so you can protect your family when you come home. But I also, on the one hand, felt grateful that I had a job that was not at risk and I got to go to work every day. But there was also this sense of sort of, am I doing the right thing? Should I be doing this? And then almost a little bit of guilt sometimes that I wasn't home to be there to help my kids with their homeschooling. And they would call me because there were 5 of them trying to get on Wi-Fi and do school and have issues. And I got frustrated at times that I wasn't there. So it's a lot of interesting dynamics. I think being a physician or any healthcare worker during this, especially, when you have a family that are all home.
I'm sure your wife handled it beautifully while you weren't there.
She will tell you she did. Absolutely. I agree.
My wife fell apart with the homeschooling. Absolutely. I came home, everyone was in a puddle when I would go to work. I would say as a physician over the last 12 months, all of us, our jobs got a little worse, right? So, and it depends. If you're an ER physician working in an ICU, nurses, doctors, I've been in touch with groups of respiratory therapists. Their jobs got real serious really fast when they used to kind of be very important, but kind of this sort of predictable pace that then they were extremely important in the hospital. What sort of things have you been able to find that you could do to support your colleagues at Trident or other people in the community?
I know it can be a bit of a cliche to talk about leadership rounds or rounding on colleagues, but I did find myself doing that a lot more. Now, I spend a lot of time with my ER colleagues as it is, just based on the nature of the work of behavioral health patients in the emergency department. But seeing them in break room or doctor's lounge and just taking a minute to talk about what's going on, what their sense is of things, and have them talk about themselves for a few minutes rather than the patients we're treating. For the colleagues that I work with directly in behavioral health, we spent a lot of time just talking about making sure that people were taking care of themselves. Were they taking the time off that they needed to, making sure we were spelling each other with coverage, and just making sure that everyone had that sort of time to replete their energy, to spend time with family. We were all feeling that burden, I think, at different levels, and just making sure that we're taking care of ourselves, but then holding each other accountable for taking care of ourselves and asking. And I know some of the younger physicians like to work extra shifts and just putting some checks on that and just making sure everyone was focused on themselves as much as they were just, coming to work and taking care of the patients every day.
Mm-hmm. I had some feedback from doctors when I would give them the idea that maybe introduce a little gratitude in their rounding. Just some small things, not these long-winded lectures on how they should be meditating. Just give them small things or something I'm grateful for. To give an example, I actually got good feedback from that. People found that useful, and definitely being able to talk about something besides this next case.
Right. And I'll give our CEO here a lot of credit. I saw him more, in the past year than just talking with people. And often those conversations were not about work. I heard a lot of conversations about families and boats and when people were going to reschedule trips and things of that nature. Maybe he's always done that. Wouldn't be surprised if he did, but it was just very noticeable how few times I heard him talking shop when he was, interacting with the physicians here.
I will say the work you did with me to make sure that ECT, which is a lifesaver in our world, but was a little difficult to put together. The work you did with me to create standards of care nationally for delivery of ECT during a pandemic were very helpful. So thank you for doing that. That had a national impact actually on delivery of services.
I appreciate you seeking out my help, and it's just incredibly satisfying to be able to be here and do what we do when so many people are struggling. And I will single out ECT, as something that just such a life changer and a game changer for patients. It's great that we're able to, after a brief pause, get that back up and running, not just here, but nationally.
I'd say that agreed 100%. I would say that as healthcare providers broadly, not just psychiatrists, we've had a lot of experiences in the last year that other people haven't. And I know you've been called to pivot even more to the community. What kind of questions are people asking you in the community, from the newspaper, from television spots I've seen you do? What do you see as the current sort of themes or trends?
So much of it is about how to handle stress in a time like this, how to stay focused on caring for yourself. And it's interesting because you and I have had a lot of conversations about physician self-care even before COVID, and what kind of message can we send and how do we really get people to take care of themselves. And, it's not a one size fits all. So the questions generally revolve around those things. Mm-hmm. and the messages are usually about being intentional, really holding yourself accountable and having someone help you stay accountable to be selfish, take care of yourself, set some boundaries. And of course, the message of asking for help and getting help, especially when stress turns into legitimate anxiety disorder, depression, or something else that needs professional treatment. The other message that I try to get out is mental health treatment is surprisingly accessible in the era of COVID. There was a lot of telemental health services already being delivered, and that has really expanded nationwide. And so while people often, unfortunately, are hesitant to seek treatment for mental illness, in a lot of ways, still have a long ways to go to get treatment to as many people that need it. But in a lot of ways, it's more accessible than it's ever been because of the expansion of telehealth services.
And we'll include a link with this, but for example, HCA Healthcare has made telehealth particularly psychiatric evaluations, they've taken away the copay for that. So it's essentially free for employees with benefits. And that's a lot of people. We set up nurse lines on top of EAP, which have been very highly used, to have a little confidential ability to talk through. And particularly what they're doing is saying, is this just normal anxiety, or am I developing a disorder that I need additional help with? So there is more out there. I think people are trying to put it out there, nonprofits, HCA, state agencies, and it's important to take advantage of that. I think we're learning as a community how to support each other. I'd like to think that's probably Pollyanna a bit, but I'll still go there.
Well, no, I agree. In the interview I did earlier today with the local newspaper, I said maybe I'm being Pollyannic, or as you said, but I do think not too many years from now, unfortunately, I think there'll be more people that need mental health treatment, but I also think it will be more readily available and insured than it's ever been. I think this is really adding to the awareness that was already out there, the growing awareness that was already out there about the need for more mental health services.
Right. I'm going to back up a little bit. Everyone that's worked, that has had the opportunity to work in healthcare settings, in particular with COVID, this is food service, this is everyone that's been in this setting, has a lot to teach about other people who only hear about it on television or the highly politicized COVID covers that was coming out for a while. They don't have the advantage that we have. I would just like to encourage everyone that's been working during COVID in healthcare to spread what they've learned. I mean, it might be simple lessons like, I washed my hands every 10 minutes and wore a mask. I was around COVID a lot and didn't get it. So this does make a difference. Just to encourage, general masking, distancing, and washing hands. I think everyone has something to contribute that can help sort of normalize and move forward and get people to get a vaccine, to wear a mask, to take care of themselves, that they've all learned it, not just coming from a psychiatrist, but coming from anyone that's worked in one of these settings.
Yeah, no, that's a great point. We've all, and so many of the things we do now that we don't think twice about, we probably saw as an imposition, just 10 months ago, and learn to adapt our behavior to, help get past all of this. And some of those behaviors are probably are well suited for the future, just in terms of continuing to take care of ourselves.
Let's talk about some things that you'll remember forever, family moments that have happened either spontaneously or planned that really stick in your mind that you'll never forget, and they'll maybe earmark the pandemic, but also earmark a pivotal time for your family.
Well, sure. Yeah, I remember. So start with the simple, the mundane. So this is April. We're in South Carolina. It's beach time, and you were not allowed to go to the beach. And so we created a little backyard area with lawn chairs, and have never had such long conversations with our teenagers as we did just sitting out there on a Saturday afternoon, just kind of passing the time. I'm picturing it as one moment. It was a series of moments over the months. And as the weather is already starting to warm up down here, and restrictions are being lifted to at least some degree, it's interesting because I looked at our beach chairs kind of hanging up in the garage and thought, man, we're probably not going to just be hanging out with our teenagers talking like we did last April. And that was actually kind of neat. I'm going to go to another one, Frank, and I'm not sure, I'm not where you expected me to go with this, but something that a lot of people have dealt with that I had to deal with personally. One part of this I'll never forget is my grandmother passing away Christmas Eve, and not being able to participate in any sort of funeral or, anything that would normally mark passing of a loved one. And I say that because I think there's not just the death of loved ones, but so many things that people haven't done, and something feels off or not right, or like it hasn't happened yet. And I think that there's going to be a lot of people kind of working through those things. So, boy, about once a day, I have to stop and say, did my grandmother really pass away? It just doesn't feel real because I didn't attend a funeral.
I think that brings a good point to end on. Sorry, and I'm sorry about her passing. The memorializing of family events is really radically changed, right? From simple things like birthdays, which people have found workarounds, definitely funerals and weddings, right?
Right. Yeah. I mean, all these, call them rituals. They're rites of passage. They are things that help us mark events and really kind of cement them in our brains as having happened, and they provide validation, even for negative things, just validation that, okay, this has happened and we're moving on. Psychologically, I think that has an impact, where people will, again, I think that can create some anxiety that something hasn't happened or it just doesn't feel quite right, or that it's happened. And, as human beings, these rituals help us to sort of, mark different things. And when we don't do them, it might just feel like something hasn't been done that needs to be done.
Mm-hmm. There's a lot of things that I think we don't even remember if we did it or not, from last year. Another day ending in Y.
It has been a time warp. Absolutely.
Mm-hmm. You should hear my daughter's plans for her birthday in the vernacular of when the virus is over. We're now going to Universal Studios to Simpsons Land, and I think she wants to spend a week there with bags of diamonds, etc. Like when we can celebrate a birthday, she's going to have a birthday. So I'm like, we'll see.
Yes. Yeah. We have had a lot of conversations about what the big family trip is going to be when we can do it. The problem is right now, between the 7 of us, we all have 7 different destinations. We have a total of 7 different destinations, so we have some work to do.
Right. My kids just got accepted to a month of camp this summer, and my wife had the opportunity to fantasize about a vacation without kids. I mean, these are things that used to just be everyday mundane, and this is now like a major celebration that might not even happen, right? So, yeah, but it's nice.
Right.
I mean, I think it's okay to engage in that kind of like fantasy planning. It does make you feel better, right?
Right, it does. We did go through a period, though, where we were fantasy planning back in April for what we were going to do in May.
Mm-hmm.
Right. So it's interesting to think about. And I think that's part of the time warp phenomenon, where you just keep waiting for things to turn the corner. And it was just such a moving target, continues to be. So we have consolidated our fantasy planning, so we're not planning multiple things.
That's funny. Well, that's about the time we have today. Thank you so much for spending time talking about it. I think you brought some very interesting ideas to light. I think we're not going to solve all these problems, but if, to your point earlier, if you acknowledge it and recognize it and move on and let the grieving process go fully through to acceptance, you can be in a better place.
Right. No, I appreciate the time, Frank, and I hope people can find our witty banter somewhat helpful and useful during this time. So thank you.
All right. Thanks a lot. We'll talk to you soon.